What I'd like to share right now is PhotoVoice that I've used for 2 projects. So PhotoVoice was developed in the late 1980s by Drs. Caroline Wang and Marianne Burgess to explore the kind of everyday realities or lived experiences of village women in Yunnan province, China. So community members were given the task of documenting their own lives via photography and then one-on-one discussions. So as far as for PhotoVoice, a little bit about the methodology, that community members are the experts in their communities. Okay, so it enables community members to reflect on their strengths, their weaknesses in their communities, and this methodology has been used really the number has increased quite a bit over the past 10 years. So it's been used to look at various community level health assets, for example, and then also related to chronic disease as well. As several of you are in the room for the plenary at noon, the speaker looking at drug abuse, this photo depicts someone's opioid medications for a week. This is a study that we did. Okay, so in other words, when I first looked at this, I didn't know what it was, and we actually did some one-on-one interviews with this patient and saw this is very, very moving and also very telling photograph. So what I'd like to do is I'm going to show you 2 very different PhotoVoice projects that I have completed over the last several years in different populations and very different research questions. The first was done about 1.5 years ago as part of a Fulbright scholarship I had in the Republic of Moldova. First off, does anyone know where Moldova is? Anybody heard of Moldova before this? Okay, so Moldova is a former Soviet republic, landlocked country between Romania and the Ukraine. Okay, it's one of the poorest countries in Europe, very, as far as resources, not very much. So what we did, the purpose of the study was to look at health-related issues among youth in the community. So this is done in Chisinau, which I have circled here, or Chisinau in Romanian, which is the capital of Moldova. So we employed both PhotoVoice and then focus group methodologies. So our participants were youth aged 10 to 17, recruited from both junior and senior high schools in the city limits of Chisinau. So we're living in the large city. We provided participants with an informed consent document written in both English and Romanian for their parents to sign, and which they did to participate in the study. So what we did is we met as small groups with participants, and we asked participants to take between 10 and 20 photographs over about a week period of various health-related issues in their community. So we left this pretty wide as far as the actual study question. Participants submitted their photographs to us electronically, generally via their cell phone, and they emailed those photographs to our research team. And then we also asked them to provide narratives in either English or Romanian as to why they took each particular photograph. Okay, so because this is a relatively young population, that most had very good command of the English language, and we really received probably about 50% in English and 50% in Romanian as far as the narratives. What we did is once we collected once the photographs were submitted to us, they were printed by a local camera shop on glossy paper so that we had a stack of photographs to bring to the focus groups. So what we did is that we had the photographs electronically on a jump drive, and then we also had printed copies of photographs for the focus group sessions. So what we did is we had 2 focus group sessions with about 6 to 8 youth in each group. I attended. We also had various of my co-investigators were fluent in both English and Romanian to help with much of the discussion. So we had 2 focus groups in a central setting in the capital city. So the participants selected photographs based on similarity or themes. So what we did is we had the photographs, put them on the table, and we had the participants look at them together and sorted them together for us. Okay, so in other words, I'll show you some photographs in a minute and how this looked. But this was very telling, kind of what we wanted to see, and actually what happened is that many of the photographs submitted by the youth were really very similar as far as themes, for example. And we used the showed mnemonic to guide the discussion of the photographs, which is developed by Dr. Wallerstein in the late 80s. So in other words, what do you see in this photograph? What's happening in this photograph? How does this relate to our lives? Why does this situation or issue exist? What can we do to address these issues? And then we also asked them, is there anything else you'd like us to let us know about this photograph? Okay, so each focus group lasted about an hour and a half. Participants were paid 150 Moldovan lei, which is equivalent at the time about $12 US. And to note actually that the average family in Moldova makes about $200 a month, so this is actually a fairly good amount of incentive. So what we did is the themes were generated during the focus groups, and then we used grounded the qualitative methodologies later on to guide the data analysis. So what we had is that the groups of participants, put the photographs into piles. This is one of the major ones, that the abundance of garbage in public spaces. Okay, as we can see that this is a picture of a planter, okay, that's used really as stagnant water. Okay, and also I think probably 80% of the children, adolescents, submitted a photograph of garbage around the city. Okay. Homeless dogs was another major concern. Okay, in other words, children playing with stray dogs, decaying dogs in the streets. Okay, which is not very uncommon in this part of the world. Unsafe drinking water. Okay, that all tap water is unsafe to drink. Bottled water was necessary. And this is really a concern among those with limited income, which is the majority of Moldovans, that they are forced really to drink unsafe drinking water. Cigarette smoking and alcohol use was another common theme related to health. And just after our study was completed, that the World Health Organization identified Moldova as the highest consumption of alcohol in the world. Okay, so this is and smoking as well too, that, very inexpensive, looking at probably under 50 cents per package for smoking, for cigarettes. So again, this is a major other issue that was identified by these youth. Living on the margins, a large number of, especially elderly Moldovans, they were actually better off during Soviet times than they are currently, just because of the shifting demographics and kind of economic makeup of the country. Suboptimal living conditions was something else that was raised. In other words, buildings no longer in their prime, washing and cooking outdoors. Okay, a lot of this is really interrelated to, poor quality of life. Okay, poor road and sidewalk conditions. This is really traffic fatalities are a leading cause of death in Moldova, not only just so much in the large city Chisinau, but outside the city as well. So what we found was that really, through the use of photography, that the youth could really relay and discuss their most common kind of health concerns, community health problems through their own camera lens. So we had about half a dozen different themes. Okay, much of the participants were very engaged, okay, and really offered solutions as to what could be done in the future. So really, both the combination of both taking the photographs and the focus groups really helped us gather information that we're trying to develop future projects to really drive health-related policy in Moldova. Second project is something that we're currently working on, kind of shifting gears completely. This is more in a clinical population. So this is, the study's kind of still ongoing, so I can give you a little bit of information. So first off, that the patients that were recruited for this study were patients that were given a certain type of medication for various chronic conditions. So what we did is we had to be able to identify the patients, that we queried the information warehouse at OSU, and if a patient was on a certain medication during these past 6 months, age 30 to 35, they were potentially eligible for the study. If the patient agreed to participate in the study, we did one-on-one interviews, and then also also administered a battery of health-related questionnaires, quality of life, understanding of medication, health literacy measures as well. They were given a disposable digital camera to take photos over about a 7-day period, and then they were given a postage-paid insured envelope to return that to us. So again, we gave them the old-fashioned disposable cameras to take photos. So what we did is we gave the participants instructions to tell us your experiences with their chronic disease, and also tell us what your life would be without chronic disease, and then having them take the photos by such and such a date. I should mention, too, that this is actually a methodology, or as far as data collection tool, as far as a disposable camera, I would not suggest using this, just because the participants could not see the photograph, and also that, we collected about 250 really nice photographs, but many of them were lost just because of the camera that we used. So given how inexpensive just digital cameras are now, this is the way that I would move towards. So we also asked them to, in other words, when you're done taking photographs, mail them back to us, and then if you have any questions in the meantime, to do this as well. So we had about 80% of those that completed the initial one-on-one interview actually completed the study, actually returned the camera to us. So what we did is we told them, this is really an important issue with PhotoVoice, to only take photos that do not threaten your personal safety, your well-being, or violate someone else's privacy. So we had about 21 patients, averaging about 53 years, nice kind of mix of ethnic, racial background of patients, and many were insured through either Medicaid or Medicare. So kind of as far as the methodology piece, once the cameras were returned to us, that we scheduled a follow-up, we printed the photographs, we scheduled a one-on-one interview again with a research assistant to try to describe to us what the photos were actually telling us. And this is something that's really necessary. In other words, when I went and picked up the photographs and looked through them, I'm like, what is some of this? And it really was only when we had the patient describe to us what the photograph represented is when we really had a good grasp of, ooh, this really does make sense and is really a great photograph. And for example, they intentionally maybe took something that was blurry. This is again our photography photograph reflection sheet. I'd be happy to share any of this information. We had summary of photographs, many different ones, 5 themes. We also did focus groups as well. Okay, in other words, where we showed different photographs to the group, and again, similar to the previous PhotoVoice study, that many of the photographs that were submitted kind of followed the same theme. So this was really something kind of the follow-up, the focus group, much rich data were generated as well. Just in light of time here. So thank you.